This is Mr. Jamal, a retired mathematician who now enjoys his retirement and spends most of his time at home, reading newspaper and watching television. Meet Manahil, a housewife and a mother of two, doing everyday house chores like looking after her kids, her husband, and the house. It all started when one day Mr. Jamal was taking his grandson to the school and Manahil was at the shopping mall buying groceries for home. And suddenly they both experienced a spinning and falling sensation called vertigo, with a ringing, buzzing, and a clicking sound in the ears known as tinnitus. During the checkup, it was diagnosed that vertigo and tinnitus were merely due to Meniere's disease and BPPV, benign proximal positional vertigo. This was a shock for them. They had no idea how to react over this situation, so they asked the doctor what could be the reason behind it. The doctor replied, "Several factors have contributed to arouse this disease. According to research, the worldwide incidence of Meniere's disease is approximately 12 out of every 1,000 people. Research shows among 20% of patients with hypertension also suffered with severe episodic symptoms of vertigo. Vertigo in hypertensive patients is not caused by elevated pressure but related with concomitant neurological or peripheral vestibular diseases as well as hypertension." Let me show you a video for better understanding. The human ear is divided in three parts: the external ear, the middle ear, and the inner ear. The inner ear consists of vestibular complex which contains the receptors of our equilibrium system, the central egg-shaped cavity called vestibule, which contains membranous sacs, the saccule and the utricle. Inside the utricle and the saccule are hair cells which are clustered in the macula, where the processes are embedded in gelatinous mass and lie under a thin layer of crystals, known as the otoliths. When the head tilts, gravity moves the crystal mass and distorts the stereocilia of the hair cells, which passes a signal to the brain. This is how the saccule and the utricle provide the information about position. After getting the understanding, they asked the doctor for an easy solution. The doctor told them Setspin to treat vertigo and tinnitus. It is believed that due to ischemic conditions in the inner ear, the endolymph suddenly begins to accumulate, which leads to an increase in pressure inside the vestibule and the cochlea. This causes an abnormal generation of signals from the vestibular complex to the brainstem, which originates spinning and falling sensation called vertigo. The accumulation of endolymph in the scala media inside the cochlea affects the organ of Corte and produces tinnitus. Now the question arises, what does Setspin actually do? Setspin contains betahistine, which acts both as a histamine H1 receptor agonist and as H3 receptor antagonist in the neuronal tissues. This H3 receptor downregulation further increases the release of histamine, which affects on the blood capillaries of the inner ear, causes vasodilation, and increases permeability. This, as a result, reduces the endolymphatic pressure and increases the vestibulocochlear blood flow. Eradicates ischemic conditions that develops endolymphatic hydrodrops, the Meniere disease. This is how Setspin diminishes vertigo and its associated symptoms. If treatment requires 3 to 6 months, then how Setspin eradicates vertigo from day 1? Setspin also found to have an inhibiting effect on spike generation of neurons in the brainstem, which inhibits the activity of vestibular nuclei, helping to restore proper balance and decrease in vertigo symptoms as soon as the drug is taken. Both Mr. Jamal and Manahil went to the pharmacy shop to purchase Setspin. On doctor's recommendation, both took Setspin for 3 months. After taking Setspin for 3 months, their recurrent episodes of vertigo and tinnitus, along with all associated problems, particularly difficulty to perform routine work, reduced day by day. And they are living a happy, healthy life. Research proves patients with Meniere's disease, unpredictable vertigo attacks are the most important symptoms. Setspin more rapidly reduces symptoms and contributes to a better functioning to sonarism. Setspin not only significantly reduces the frequency, intensity, and duration of vertigo attacks, but also significantly improves the patient's quality of life. A winning shot against spin is always difficult. Setspin, a win against spin. PharmEvo is thankful to all viewers for helping us to promote awareness regarding vertigo and its common causes by Setspin's case-based video show for a better and effective management and treatment of disease. Thank you.